Hey everybody, welcome to our next video about veterinary medical manipulation. Today I want to talk to you about why restrictions are so bad. Those are what we are trying to remove while we're doing our manipulations. And so why? Why are they so bad? Why are they things we want to get rid of? So first we're going to start with the local effects of those restrictions. The first thing that we run into with restrictions is a lack of movement. And without movement, our cartilage starts to suffer. So the cartilage is at the end of every bone in a joint, and it creates just a little bit of cushion. The bone underneath that cartilage is very, very sensitive. And so it's kind of a buffer. If you know anyone who's had bone on bone in a joint, you know how incredibly uncomfortable and how incredibly painful that is. And so with movement, our cartilage is healthy. Without movement, our cartilage starts to degenerate and break down. So when we have a restriction and we cannot move through our full range of motion like we're supposed to, our cartilage starts to suffer. Once we also have lack of movement in that joint, it only takes a few days for adhesions to start to form. And so adhesions are also going to restrict that range of motion. We're going to go from full range of motion to limited range of motion to even more limited range of motion. And with that, it starts to affect our circulation. And lack of movement also creates a lack of circulation in that area. And we require blood to every organ in our body to maintain health. And so our joints are no exception. And so without movement, our cartilage starts to suffer, we start to form adhesions, and our circulation starts to decrease within that joint. Okay, on to the second category of effects caused by restrictions. That would be within our nervous system. So the first thing is our brain. Our brain requires constant feedback from our body. And I'm sure you've heard the term, if you don't use it, you lose it. And so that is very common with our brain. So we need to move so that our brain can understand the world around us. So that's one nervous system effect of restrictions. The other is pain. If we are painful, our brain is processing that pain. It's processing those stimulations from our environment. And that can be very detrimental to our daily lives. Peripheral nerve function is also started to be affected as well. If you have a restriction within your spinal column and those spinal nerves are pinched, you can start to have peripheral nerve function decrease. And then finally is movement helps to decrease pain. So think about when you get up in the morning and you're kind of stiff, and after several steps, you start to loosen up, your joints start to loosen up. And so you start to feel better. Movement is the reason for that. You have a decrease in pain receptors with that movement. The third category that is affected by restrictions is compensatory. So we think of what happens next to that restriction. If we have a restriction at C3, C4, what's happening above and below that? Typically those joints above and below actually become hypermobile. And so we have the restriction which decreases range of motion within that joint, but it actually forces the joints next to it to go outside of their range of motion. And that can be dangerous. That's when we start to get injuries. To prevent that, what our body does is it creates muscle spasms. And so we have muscle spasms to try and hold those hypermobile joints in place. And that can be very uncomfortable too. If you or somebody else has back spasms or muscle spasms within their neck, that can be extremely uncomfortable. And so if we fix the initial restrictions, we can sometimes help to decrease those the muscle spasms, because we're not trying to hold that joint in place anymore, because it's no longer hypermobile because we fixed the restriction with the decreased range of motion. And then finally, we think of our tendons. So our muscles are attached to bones by tendons. And so our muscles stretch, our muscles contract. Our tendons typically do not. So if we have a muscle in spasm, it's putting excessive tension on our tendons. And if we continue to do activity, our dogs continue to run in the backyard, they continue to do agility, they continue to do fly ball, we're putting excessive tension on that tendon, and it's kind of a ticking time bomb. We're just waiting for it to stretch, tear, sprain, strain, injure that tendon, and tendon injuries are very difficult to heal. So those are the categories that we focus on mostly when we talk about restrictions, and why it's so important to get rid of the restrictions within the body. We have local effects, we have nervous system effects, and we have compensatory effects. So stay tuned to our next video for a little bit more information. Thanks.